That moment when you finish peeing, everything seems fine. Then, seconds later, you feel wetness in your underwear. It's embarrassing, frustrating, and makes you wonder if something's medically wrong. I'm Dr. Rachel Morgan, urologist. Today, I'm breaking down why post void dribbling happens, especially after 50. The three main causes, including one that affects 80% of men over 70, and the practical solutions that work immediately, including a simple massage technique that prevents leakage every time. This isn't about aging gracefully. This is about understanding what's happening and fixing it. Drop a comment with where you're watching from and your age. This helps me create relevant content for you. Let's get started. Let me start by explaining what we're actually talking about, because understanding the terminology helps you discuss this with doctors if needed. That little bit of urine that leaks out after you've finished urinating is called post void dribble. And when we look at research studies on how common this is, the numbers vary widely, anywhere from 5% to 58% of men. But based on my clinical experience, I can tell you it's far more common than 5%. Most men just don't talk about it. They assume it's normal aging, or they're too embarrassed to bring it up, or they think nothing can be done about it. But here's the truth. Post-void dribble is common, yes, but it's not something you have to accept. And in many cases, it's a sign of something specific happening in your anatomy that can be addressed. The key is understanding why urine gets trapped in the first place, because once you know where it's hiding and why, the solutions become obvious. There are three main reasons why urine dribbles out after you think you're finished. Cause 1, urethral narrowing or stricture. Your urethra is the tube that carries urine from your bladder out through your penis. If there's a narrowing anywhere along that tube, called a stricture, urine can get trapped behind that narrow spot. When you urinate, your bladder pushes urine through with as much force as it can. Most of the urine makes it past the narrowing, but some gets stuck on the other side. Then, once your bladder relaxes and you think you're done, that trapped urine slowly works its way through the narrowing and leaks out. Men with urethral strictures often notice other symptoms too: weak stream, difficulty starting urination, or urine that sprays in different directions instead of coming out in a single stream. If you're experiencing any of these symptoms along with post-void dribble, you need to see a urologist. Strictures require evaluation and treatment, and they won't resolve on their own. Cause 2, prostatic urethral trapping, and this is the most common cause in men over 50. Your prostate is a walnut-shaped gland that sits underneath your bladder, wrapped around your urethra. As you age, the prostate naturally enlarges in most men. This condition is called benign prostatic hyperplasia, or BPH, and it affects up to 80% of men over 70. Now, here's what happens anatomically. Men have two sphincters that control urine flow. One is at the bladder neck, right where your bladder connects to your urethra. The other is just below your prostate, called the external sphincter. When you finish urinating, the bladder neck sphincter closes first. But if your enlarged prostate has created a pocket or curve in your urethra, some urine can remain trapped between the bladder neck and the external sphincter. Then, when you walk away and that external sphincter relaxes, the trapped urine leaks out. This is why men with enlarged prostates often experience post-void dribble even when they feel like they've completely emptied their bladder. If you have other symptoms of BPH, like weak stream, difficulty starting urination, frequent urination, especially at night, or a sense of incomplete emptying, treating your enlarged prostate will often improve the dribbling as well. Cause 3, weak pelvic floor muscles. This is sometimes called idiopathic post-void dribble, which means we don't have a single clear structural cause, but we do understand the mechanism. Your pelvic floor includes several muscles that wrap around your urethra, including muscles called the bulbocavernosus and ischiocavernosus. These muscles normally contract during and after urination to help propel the last bit of urine forward and out through the tip of the penis. But as men age, or in certain neurological conditions, these muscles can weaken. When they're weak, they can't effectively squeeze that final bit of urine out, so it remains in the urethra and leaks out later. This is particularly common in men who've never done any pelvic floor strengthening exercises, which most men haven't because no one teaches this. The good news is that weak pelvic floor muscles respond very well to targeted exercises, which I'll show you in a moment. Now, while we're discussing urinary function and what's normal versus concerning after 50, there's a simple self-test every man should know that checks penile health and circulation. It takes 30 seconds, costs nothing, and can give you early warning if something needs medical attention. I explain exactly how to do this test in another video. Watch it after this one. Let me give you the practical solutions for post-void dribble. Now let's talk about what you can actually do to prevent post-void dribble, starting with the simplest, most immediate techniques. Solution 1. Bulbar urethral massage. This works immediately and takes 5 seconds. Right after you finish urinating, while you're still standing at the toilet or urinal, take your fingertips and place them about 1 inch behind your scrotum. You're pressing on the area called the perineum, which is the space between your scrotum and anus. Now press upward and forward toward the base of your penis while applying firm but gentle pressure. What you're doing is manually pushing any trapped urine forward through your urethra and out through the tip of your penis. Do this once or twice, pressing firmly from back to front, and you'll notice that last bit of urine comes out right there at the toilet instead of into your underwear later. This technique is simple, effective, and works immediately. Many men find that this alone solves their post-void dribble problem completely. You can also try gently shaking, squeezing, or stretching your penis after urinating to help expel any remaining urine. Find what works best for you. Solution 2. Pelvic floor strengthening exercises, also called Kegel exercises. Now, before I explain how to do these, let me give you an important warning. If you have chronic pelvic pain, pain with ejaculation, testicular pain, or certain urinary symptoms, do not start pelvic floor exercises without talking to a urologist or pelvic floor physical therapist first. Over tightening already tense pelvic floor muscles can make those problems worse. But if you don't have those issues, Kegel exercises can be incredibly helpful for improving pelvic floor strength and reducing post-void dribble. Here's how to do them correctly, because most men don't know. The sensation you're looking for is like stopping your urine flow midstream, but you don't actually want to practice this while urinating. You do these exercises when you're not urinating. Another way to think about it is trying to lift your penis up toward your belly button without using your hands, just using your internal muscles. You should feel a tightening and lifting sensation in your pelvic floor. Once you've located the right muscles, here's the exercise protocol. Contract those muscles and hold for 5 seconds. Really squeeze. Then release completely and relax for 5 seconds. The relaxation phase is just as important as the contraction phase. If you skip the relaxation, you can create excessive tension and cause problems. Repeat this contraction and relaxation cycle 10 to 15 times. Do this entire set twice daily, once in the morning and once in the evening. Within a few weeks of consistent practice, most men notice significant improvement. The muscles become stronger and more responsive, which means better control over that final bit of urine. Solution 3. Addressing underlying causes. If your post-void dribble is caused by a urethral stricture or enlarged prostate, the dribbling is a symptom of a larger issue that needs treatment. For urethral strictures, depending on severity and location, treatment might include dilation, a procedure to widen the narrowing, or in some cases, surgical repair. For enlarged prostates, there are many effective treatments, ranging from medications that shrink the prostate or relax the muscles around it, to minimally invasive procedures, to surgical options for more severe cases. Treating the underlying condition often resolves or significantly improves post-void dribble. If you're experiencing other urinary symptoms along with dribbling, particularly weak stream, difficulty starting, frequent nighttime urination, or incomplete emptying, see a urologist for evaluation. Let me summarize what you need to remember. Post-void dribble is extremely common in men, especially after 50, and it gets more common with age. But it's not something you have to accept as inevitable. There are 3 main causes: urethral narrowing, which requires medical evaluation; prostatic urethral trapping from an enlarged prostate, which also benefits from medical treatment; and weak pelvic floor muscles, which respond well to targeted exercises. The simplest, most immediate solution is bulbar urethral massage. Right after urinating, press firmly with your fingertips about 1 inch behind your scrotum, pushing upward and forward toward the base of your penis. This manually expels trapped urine and works immediately. For long-term improvement, practice pelvic floor exercises daily. Contract for 5 seconds, relax for 5 seconds. Repeat 10 to 15 times, twice daily. Within weeks, you'll notice stronger muscles and better control. If you have other urinary symptoms like weak stream, difficulty starting, frequent nighttime urination, or incomplete emptying, see a urologist. These suggest an underlying condition that benefits from treatment. Most importantly, don't suffer in embarrassed silence. This problem is fixable, and the solutions are simple once you understand the anatomy behind it. If this information helped you, hit that like button and share it with someone who might benefit. Subscribe for more practical, honest men's health guidance. Before you go, remember that video I mentioned about the firmness test every man over 50 should know. It's a simple 30-second self-check that can give you early warning about circulation and tissue health. Don't skip it. I'm Dr. Rachel Morgan. Small anatomical knowledge creates big improvements in daily quality of life. Thanks for watching, and I'll see you in the next video.